Hi there, I'm Dr. Pirmzen from Dripiv Wellness and Med Spa, talking to you about weight loss. So obviously with it being January, everyone is trying to do a better, newer me kind of situation. What we're looking for is a healthier you. And with Dripiv Wellness and Med Spa, what we're offering is weight loss options, health conscious options, and ways that people can actually lose weight in a great manner that is sustainable. There's definitely lots of different fads out there that let you lose weight immediately, and then unfortunately people put it right back on. What we're looking for is something that is life-changing. So what we'll do is we'll talk about myself first. I am on our weight loss program. I'm down 60 pounds myself, which is absolutely incredible with all the poor habits that I normally have just because of how busy I am. And we all have similar excuses where we're just not eating right, we're not exercising the way we should be, and unfortunately we're adding on those pounds that are negatively affecting our health. So obviously increased weight leads to high blood pressure, high cholesterol, diabetes, heart problems. So the goal of all of this is obviously to lose that weight, to make sure that we're not heading in that bad direction. There are multiple different options out there. What we're going to talk about today is weight loss options that include our GLP-1 peptides. So these are your semaglutide, tirzepatide medications. These medications are the popular ones that we're all hearing about, both brand name and compounded versions. And we'll talk about the differences between what those offer. And then we have other options such as nutrients, vitamins, minerals, what we call our fat blaster injections. And then we have cosmetic ways to lose weight as well. So what I did myself that's helped me lose 60 pounds in just about 9-10 months is our compounded medication. So this medication is using the active ingredients of semaglutide, and what that does is it helps to burn fat. So let's talk about these GLP-1s. GLP-1 receptor agonist medications. Initially, the FDA approved it back in 2005 for diabetes. And what happened was people who were diabetic were taking these medications, their blood sugars were very well controlled, and what they realized in these studies was, as a side effect of the medication, people were dropping 19% to 21% of their body weight, which for someone that's, let's say, 200, 250 pounds, you're talking about a significant amount of weight. People were losing 40 to 60 pounds. And this was across the board. So it didn't matter how healthy they were, how unhealthy they were. So the manufacturers of these medications obviously saw a golden opportunity to help people lose weight. The unfortunate part is insurance companies dictate if a medication is covered or not, and the pharmaceuticals dictate what the price of these medications are. So a lot of these medications are not covered for weight loss, even though they're FDA approved for weight loss. So this creates an opportunity for what's called compounded medications. So in times where there's a shortage of a medication, a compounding pharmacy, which is FDA approved, can make these medications for you, and by a physician or a nurse practitioner telling the pharmacy which amount and what dosing to give you, we can actually give you these medications at a substantial decrease in cost. So what we're able to offer is these compounded versions of medications, which are not the brand names. They are the compounded semaglutide, tirzepatide, injectables, as well as a oral version of the semaglutide that can be anywhere from 1/10 of the cost of what the brand names are. So people are able to actually lose weight, keep this weight off, and actually get access to these medications. Now we do offer as well to do the brand names, but those are very difficult to do since it requires insurance approval, and most of the time it's unfortunately rejected. So let's talk about these medications. What do they do? These medications, one, decrease appetite, they decrease cravings, and they help to actually burn the fat themselves. Now, obviously, all medications have side effects. And the mechanism of the action of these medications, which is increasing insulin production in the pancreas and reducing the amount of sugar that the liver actually produces, slows down digestion, which reduces your appetite, so you're not as hungry. These medications are long-acting, which means you do these injections once a week, and they stay in your system throughout. So they lower that blood sugar, they decrease the motility in your gut, so you're not digesting the food as fast, which means you're not as hungry. So since you're not digesting the food and you're not hungry, you obviously take in less. And what we realize is, over time, your stomach starts to shrink, and naturally, you just don't want to eat as much. So not only does it help to keep you from gaining weight, it decreases your weight, and it hopefully keeps it more consistent. So we'll talk about myself again. About a year ago, I was at the heaviest I've ever been in my life. And being in this wellness environment, it looked pretty poor on myself to be so overweight. So I caved in and I said, you know what? Let's do the weight loss and let's see how we do with it. I have tried other medications before that intermittently help. I gained the weight right back when I stopped taking it. So I said, let's try this and see how we do. I don't like it to inject myself, but it's a tiny needle, gets shipped right to your house, you inject yourself, and it's nice and easy. We have videos of how you can do it, so all the instructions are actually there for you. So these medications are prescribed to you by our nurse practitioner who does all of our weight loss. You see a dietitian who actually goes over your diet to improve the weight loss itself and to help give you a healthy diet. And then we talk about how we can supplement these medications with other things, such as, like I said before, our fat blasters, which is B12 injections, which help to build up red blood cells, get more oxygen to the body. They have added benefit of weight loss. We have our IV drips, such as our lean drip, which has alpha lipoic acid, helps to digest fat in the liver. And then we have cosmetic things, such as Kybella, which I've done myself, where you do injections into the fat on the side to help digest the fat, and it breaks it down. We have different modalities that help to actually break the fat down manually. We use, let's say, cryotherapy or ultrasound therapy to help break down the fat and help your body actually lose the fat in the areas that are really tough to get rid of. And by doing these modalities, you can actually trim the fat, you can tone the muscles, and you can get that look that you're looking for. And most importantly, drop that weight so your health improves. So we'll go over how this happens real quick. You have a televisit, just like what we're talking about right now. Our provider gets on the phone with you. They talk to you about your goals. They see if you're approved for the medication. So as long as you have a BMI greater than 25, which unfortunately puts you in the overweight category, then we feel that this medication will be a benefit for you. Once we get you signed up, the medication gets shipped to your home. You give yourself that once weekly injection based on your dosing. Usually it starts off at a very low dose because these medications can cause side effects. They can cause vomiting, diarrhea, constipation, anything GI related. Worst case scenario, most serious, is pancreatitis, gastroparesis, bowel obstructions, gallstone attacks. But by going at a low dose, you can limit those side effects to make sure that you are able to actually take the medication. Some places, unfortunately, they go at the highest dose. Their patients don't do as well, so they come off of it with no benefit. We do what's the FDA approved way of doing it, which is going at a low dose, getting your body used to the medications, and then getting ramped up to the high dose where you really see that weight loss benefit. And then once you reach that main goal, it's simply staying at that level until you feel like you've reached your goal, and then either coming off the medication or staying at a low maintenance dose to help you still stop those cravings. And when I'm talking about it stops cravings, literally you can sit next to, that bag of candy or chocolate or whatever it is that your heart has always desired, and not even care that it's sitting there. So that was a quick rundown of the process of the medications. There are other medications that we also use, such as phentermine, that's tried and true. But these medications that obviously everyone is now hearing about seem to be a better, longer, and more effective manner of losing weight and keeping it off. So hopefully that gives you guys a little information of what we do. This medication, like I said, is available through our program. So you can go to www.dripivmedspa.com or call us at 877-374-7487, option 2, to go ahead and set that appointment and get that look that you're looking for. So again, I appreciate it, and thanks for listening.